Hey everyone, I'm Dr. Kelly Starrett with the Ready State. I want to talk to you about one of the features of the H-wave that sometimes gets lost in the conversation around chronic pain and potentially post-surgery. We often see that our athletes in our active populations have to use their bodies for a specific task, and they can't sort of be sidelined by a painful condition. Remember, the H-wave has two settings. We have a low frequency setting, which allows us to pump and decongest, and we have a high frequency setting, which gives us access to on-demand, drug-free pain relief. And that's important because oftentimes we'll have an athlete who has to compete or a person who has to engage in some very strenuous activity for their job, but we're going to be rate limited or we're going to be sort of controlled by a significantly painful area. Now clearly, it is a grown-up decision to decide to work or decide to play with high levels of pain. But in the realities of working in professional athletics or in situations where sometimes someone has some discomfort and they still need to compete, it's going to happen. So what we love to use is the fact that we have this H-wave high frequency setting, which means that we can give this athlete some on-demand pain relief, we can reduce their pain symptoms and create a window of opportunity where they can have better pain relief and more importantly, less pain with movement so that they can perform their job, they can occupy their role on the team or in society or in the squad, and they can do that effectively without having to take massive amounts of anti-inflammatories or potentially massive amounts of sort of like a classic opiate substance. So when we end up creating choices and options and agency for our athletes, oftentimes we find that a quick 30-minute session of some high frequency allows us to feel better so that we can go do our job, and then we can have the next conversation about root causes. How are we going to calm that down? How are we going to get this athlete, this person back into the role pain-free? But in the meantime, we need a solution because our athletes are going to ignore us and go ahead and play without it anyway. So this gives us a real way where we can be an advocate for the athlete while we're still helping them manage sort of long-term health and fitness and wellness.